The Jubilee of the Sick and Healthcare Workers will be celebrated in Rome this weekend on the 5th and 6th of April. This theme is for us to recognize the unique vocation of healthcare workers during this Jubilee. This includes doctors, nurses, health workers, volunteers in the health sector, pastoral health workers, and others. Now, 10 or 20 years ago, parents would want their children to be in the top 3 profession, that is either doctor, lawyer, or engineer. Well, earlier when I spoke to Dr. Ian, I asked him whether this was the case with him.
Well, I think, yeah, when I was going to study medicine, that was the case. I don't think it is the case now, not only here in Malaysia, but I think across the globe, especially among the younger, the younger working adults or those who just left school. It is not a very appealing option, except for, unless you're really, those who are really passionate about it. Many factors, I think, contribute to that because I suppose it's not as rewarding and it doesn't promise you the best lifestyle, with the long working hours and, the long waits for your career pathway development, and various other issues. So now there are so many other things that they can do to make money, which require a lot less effort, and especially with social media around and the things you can do with that, you see. So I don't think it's among top 3 anymore. Yeah, but I hope that changes. But yeah, that's the reality at this point of time.
Now, we know learning to be a doctor is not easy and it takes a very long time. Now, I asked Dr. Ian what kept him motivated throughout the stages in his process or transition to become a doctor.
I think for me, the main thing was the love for the job, the passion I had, and basically being in the line of service. As difficult as it is a very rewarding line. Probably not financially, but in a lot of other aspects, as a person, as an individual, as someone who comes in contact with people a lot. There's a lot you learn from each other, from like even ours, say in the medical line, from our patients. Of course, in other lines of service, they do come in contact with a lot of people, and this sort of contributes to your growth, So when you look at it from that angle, yeah, it is easy to find motivation in the things we do. Although there are definitely challenges and difficulties, but we have to look for these final points to keep us motivated, carry on.
Well, if you're anything like me, I like to watch those doctor programs or medical dramas on TV. And I wanted to know from Dr. Ian whether that's actually the scenario, that's what happens in the hospitals here in Malaysia.
Well, most of it, I think it is true. The facts, most of the shows are pretty factual. But I suppose what is not very, doesn't tally with sort of our day-to-day thing is probably the volume of things that, go on there. The hectic lifestyle, yes, it is there, but it's not exactly a day-to-day thing. You have moments where you have good days where you're not that busy, but you have those days where you're swamped, and yeah. So in that sense, that's where the difference lies with the TV and what we do on a daily basis. Yeah.
Now, the recent pandemic was a very scary time for all of us, and that's when we really saw the struggles and sacrifices of doctors, nurses, and healthcare professionals. I wanted to know from Dr. Ian his thoughts looking back at the pandemic and coming out of it.
And I think the first thing I am is grateful that we came out of it and we're not in that sort of environment or situation anymore. Second thing, of course, grateful to have survived it in spite of all the hardships. And yeah, it was a good wake-up call for us and to everyone else. And it also brought forth also a lot of changes that probably were necessary. For instance, like online meetings like such were not something very common, especially in the healthcare, in the medical industry, where healthcare was concerned. But when that changed, we were forced to take a step in that direction, and that has helped us a lot, especially when it came down to, exchanges of ideas with international colleagues and peers, and, so it has been quite helpful in that sense. So at the end of the day, if I'm saying anything, just to sum it up, I'm just grateful. Yeah.
But also there's the element of fear, right? So for us, like we are at homes, even then we are very fearful. But what about you who are actually in contact with that virus? I mean, with patients and all that, and not just for yourself, but your family members, and you go back home, I'm sure you got to isolate yourself and stuff. What was the fear like for you?
So yeah, at the beginning, especially when, basically the fear of the unknown, when we didn't know very much about the virus, the only thing we knew was it was very deadly, it was very contagious. What could keep it from being, contagious at that point of time when we started was not very clear. So we just had to take, all the measures necessary, to stay safe, and all the precautions. Of course, as you mentioned, isolate ourselves from the families, The fear was definitely there, but we were basically driven by the fact that we had to keep our patients alive, and we had to keep others from falling ill. And so when you're sort of overwhelmed by all that, it sort of distracts you in a way from the fear. And I suppose that's how we got through it, Yeah.
Health matters is something that a lot of us think about, especially when we get older. But as a doctor who see people with illnesses and sickness and people dying in hospitals, I wonder if that really affects their decision and choices in life.
Definitely. So, as you said, as you rightly mentioned, probably our choices in terms of our way of life, our lifestyle, our food and everything we do. Obviously, when we see, patients coming in, and at this point of time, just for example, you get a lot. We're getting more and more younger patients with problems like heart problems or heart disease, which at one point of time we only see in the elderly, or those above 50. Now we're getting 20-year-olds, 30-year-olds with heart problems. And of course, that again is a reminder to us that we really have to take good care of our health and what we do. Obviously, it's not that easy. Not every doctor does it. And another point, I think in terms of our decision making, and I think we value life, our day-to-day life a lot more, faced with life and death on a day-to-day basis, on a daily basis. We are just reminded of the fragility of life itself. So it teaches me, not to sweat the smaller things, and to be very grateful even for the smallest blessings that we have. So in that sense, that's what being someone in the healthcare line has taught me.
World Health Day is celebrated on 7th of April, and this year's theme for the campaign is on maternal and newborn health, titled Healthy Beginnings, Hopeful Futures. Now, Dr. Ian is a gynecologist, and this really relates to his work. And this being his specialty, I asked Dr. Ian, how adequate is Malaysia in terms of quality for pregnant women and babies?
Sometimes it sounds, when we read the UN stuff and all that, it's really targeting like poorer countries, But how adequate is the Malaysian medical industry in terms of these areas? Are we? I'm sure we're not like really up there, but are we compatible?
Well, we are, especially in the last 10 years, we've seen the shift to better standards of healthcare, mainly in terms of access to healthcare. How healthcare has become accessible to others. We may not see it in these bigger cities and towns. You may not experience a difference. Probably you will see, the only thing you notice in the bigger cities is maybe the equipment, the equipment that they have. Probably, I would say, we do use a lot of the more modern equipment, and we try to keep up to date in that sense. Okay, use the newer equipment, and where you see the difference is actually in the rural areas. Where once upon a time, the hospitals, they didn't even have doctors in the hospitals or the district clinics. It was run by hospital assistants. But now that we're producing more and more doctors, and training more and more specialists, so we get a decent amount of doctors in these areas. And so access to healthcare has definitely improved. That being said, still a lot needs to be done, especially in these rural areas, to minimize the complications and the the morbidity, in these areas, so that we can move to achieve this sort of a status of a developed country, in that sense, as far as healthcare is concerned. Yeah.
My wife and I were parents, new parents, that is, about 3 years ago. And what we realized is that there were many things that we didn't know of. And so I thought it's a good time to ask Dr. Ian, what are some of the essentials for newborn care? Maybe new parents or those who are going to become parents pretty soon, maybe this might be very beneficial and useful for them.
So obviously the top would be access to healthcare services, not only for the delivery. So the journey of the child starts at the beginning of pregnancy, from conception. Okay? So how the child is going to turn out, what happens to the child later on starts in the womb. Okay, so access to healthcare from that point of time. So we need proper, what we call antenatal healthcare, which most district clinics and hospitals offer. So as you said earlier, usually the lower risk patients or lower risk mothers will be managed in the primary care, okay, in the district clinics. And then if it becomes a bit more complicated, mothers have some underlying issues, that they get referred to us in bigger centers, and we address that accordingly. So that's probably the first thing. Now the second thing is obviously the mother has to be empowered. And again, that starts with us in healthcare, and also as a community, and how we are going to empower these women to carry on this pregnancy and to make it a very smooth and very smooth and uneventful pregnancy as much as possible. So we have to sort of educate them. We have to highlight the importance of proper antenatal care throughout their pregnancy, not only for the babies but for themselves as well. Because a lot of conditions, we notice pregnancies can continue or can carry on till after delivery. So this is very important as well and has to be addressed. The next thing is a safe birthing, a safe environment for delivery. We have to provide access to services where they provide safe deliveries for both the mother and babies, because this is a very crucial time when we lose a lot of mothers or babies, and the mortalities are highest at this stage during delivery. So that is the next most important thing. Now, obviously, another important thing will be nutrition during pregnancy, after pregnancy, for the mother and for the child themselves. So they have to be aware of the importance of breastfeeding, breastfeeding exclusively, if possible, whenever possible, and they have to have the right, proper access to healthy food, and of course, it's a bit difficult because the reality is eating healthy is more costly nowadays, and it shouldn't be that way. It shouldn't be that way. In some developed countries, eating healthy is actually a cheaper option. They make it difficult for a person to have an unhealthy diet. So we have to try to move in that direction. Again, easier said than done, but that's something we have to really consider and look into really seriously. And probably another important thing is support to the mother or even to a couple of a newborn, in terms of what is really necessary, what the reality of having a newborn is, what are the challenges associated with it, what needs to be done, not only during the delivery period, because we find that lots of couples, they're very eager, they're very excited, preparing only for delivery, not knowing what's to come, So that in itself, can pose a lot of problems, even to the relationship, among between a husband and wife. And so this has to be really addressed or highlighted, early on, so that a parent of a newborn has a picture of what to expect, a rough picture of what to expect.
To end this conversation on Herald Voices, I asked Dr. Ian if he had any message or encouragement for those who are thinking of entering the health profession.
So obviously, I would say, ask yourself why you want to do it. The next thing, and this is something I did myself, is this something you can do for the next 30, 40 years of your life and enjoy it, So if you made the decision to do it, then learn to enjoy it, because a significant part of it is challenging, is difficult. It involves a lot of sacrifice, personal sacrifice as well. But if you find ways to keep yourself motivated and see the good that you're doing, on a daily basis, then you will survive it. You will survive it, and you will eventually enjoy being a healthcare professional.
Okay, Dr. Ian, first of all, happy World Health Day, and also this Jubilee weekend for the sick and for health workers. We will keep you and all the doctors, nurses, and healthcare professionals in our prayers this weekend. I suppose have a blessed weekend. It's especially for you.
Thank you so much. I appreciate it. Happy World Health Day to everybody.
That was Dr. Ian Michael Netto speaking with us on Herald Voices, as it is the Jubilee of the Sick and Healthcare Workers this weekend, the 5th and 6th of April, and World Health Day on 7th of April. Now, we also spoke to a nurse who had been diagnosed with breast cancer recently as well, and we have that interview in its audio format also on Herald Voices. The link will be in the description. Well, as we end, let's just lift up all the doctors, nurses, and healthcare professionals and caregivers in our prayers this weekend. And also, World Health Day is coming up. Please do take care of your health. And if you need to find out more about anything at all that you think you're suffering with or are worried about, please do so and consult your doctor to find out more and be informed. And we'll see you in the next episode of Herald Voices. I'm Kachang Kevin. Stay blessed.